So not to be picking on her, but Shirley Jackson back here keeps us on our toes with our health. There's the team. The team is here. They're pointing fingers. So we want to keep this. I was asked by Kim to if I would be willing to moderate. So for those that don't know, I think she asked me because she knows. I do like to do things on time. I'm also the CEO of part of Ohio Family Health Centers. So we have 2 federally qualified health centers. That means that we are the safety net in the community. There's several of us here in Franklin County that do that. We have one of our sites is in Whitehall, and then we have another site which is brand new. It's a $4.4 million building at Ennis and Westerville Roads. At the corner there. So again, our particular health centers, we have a little over 6,000 patients last year, a little more than 19,000, almost 20,000 visits. So if you have questions about that, you can see me. And before we continue on, we have Mr. Willie Morgan. He's here. He's going to offer a prayer for us so that we can have a good year.
Oh, Heavenly Father, thank you for this opportunity to assemble and hope that this informative gathering will be very knowledgeable and we can use it to better further our journey with you. We ask you, Lord, that you guide us and strengthen, help our spirit to be in tune with your spirit, and help us, Lord, walk in faith and God's spirit. Thank you, Lord, for everything in your Son Jesus' name. Amen.
So just a real quick couple of things before we get started. One, for those of you that don't know, welcome. Yeah. Put you on the spot. So for those of you that don't know, there are restrooms. There's a men's restroom right across the hall. Ladies' restroom is outdoor and to the left. We do have a couple of announcements. We hope that anyone who wants to participate in these will come out. The first is this Saturday, September 14th. There is an ice cream social. You'll see our friend back here for more information about that, but it's the 5th anniversary. It's an ice cream social at 1536 Oak Street from 2 to 5. Donations are welcome. Bring your own lawn chair. I'm sure you do that. Live music, spoken word, storytellers, wellness screenings. It looks like a great event. There's also line dancing for those of us who know something more than the electric slide. Okay, so there's the ice cream social. We have a couple of copies of that if you'd like it. Also here at the church on Tuesday, September 17th. Oh no, I'm sorry, at the Urban League. On Tuesday the 17th, there's a grant writing workshop. So for those of you interested in learning more about grant writing, that's from 5:30 to 8 at the Urban League on the 17th. And then at the, this is a computer basics for seniors, senior novice. There are levels, novice, intermediate, and advanced. This is for the novice. You also might want to know how to use your cell phones, probably. Tuesday, September 24th from 4:30 to 6:30, and at the main library, 96 South Grant. And I think you should see probably Kim over here about the computer basics. You teach this course, right, Kim?
Yes.
Yes, see Kim for that, and 2 others. September 21st, which is a Saturday, is the 5th annual HBCU College Fair at Barnett Recreation Center. You can see me about that. My son puts that on. It's a volunteer. It's all free. I think he has 25 schools represented. They also have workshops on financial aid, etc. They have students there and alum who can talk about campus life. at the different HBCUs. And then finally, on September 28th, Sister to Sister here at Love Zion, from 2 to 6 is the Spa La La. So those who are interested in a spa experience, see us for that. The last thing is that, and I'll try to remind you when we get to that portion, that this is being broadcast live. So if you have questions or comments, you want to speak up so the microphone can pick you up, and everybody can hear what you have to say, questions. So now, I'm going to introduce, this is Michaela Monahan. I keep wanting to say Monahan because you know that's my hero. Okay, and she's with CMS as the Center for Medicaid, Medicare Services in this region. And the purpose of the presentation, just so that we're all on the same page this evening, is that this is really just information sharing, getting you a little bit more acquainted with the whole marketplace, which most of us have heard about, but it will take effect. Actually, open enrollment begins on October 1st of this year, and actually is in effect in January of 2014. So with that, we have a bunch of statistics. If you want to know some statistics, see me, but I think it's better if we just dive into the presentation now, and then leave plenty of time for any questions that you may have.
Thank you very much. All right, I'm going to stay a little bit close to the computer just so I can move the slides. Can everybody see and hear me okay?
Yes.
Thank you so much to Love Zion Baptist Church, and also to the Growing Hearts and Hands Community Garden, who was my entryway into the community tonight. So I want to thank both entities very much for having me this evening. I am Michaela Monahan. I'm from the Centers for Medicare and Medicaid Services. I'm in the Chicago Regional Office. And so a little background on that is that the agency in general is out of Baltimore, Maryland, on the East Coast. But we have regional offices across the country, and we sort of manage Medicare operations, and we work with the states with the Medicaid programs, and now we're helping roll out the health insurance marketplace as a result of the Affordable Care Act. And so that's one of our jobs, and I am delighted to be here. I am the Ohio Outreach Lead for the health insurance marketplace. And I went to school, actually, in Ohio. My undergrad is from University of Dayton. So I love being here. My best friend is not here tonight, actually. She's in Massachusetts. But usually I get to come into town and see my best friend, Nikki, and I love Ohio. So I'm really delighted that I was joined the Ohio team and got to lead the outreach and education. So, as it was mentioned, my goal is really to have an informative discussion, give you some information about the Affordable Care Act and about the health insurance marketplace. Just a little primer to get your feet wet, and then we'll do some question and answers if you have some more specific questions. So with that in mind, one of the things that we do like to mention is that right now the focus is very much on October 1st, and you're going to find out why in a little bit. So we do want to mention as an agency that there are a lot of things that have already happened as a result of the Affordable Care Act, up to date. So it's not just all brand new information rolling out. We had just over 3 million young adults who previously graduating high school or college may have lost their health insurance due to their parents' insurance terms. And now those young adults have access sometimes to their parents and health insurance now as a result of the Affordable Care Act up until the age of 26. We have 6.1 million people with Medicare who are currently receiving, as you can see, just under $6 billion in discounts for their prescription drug costs. And that was when they would traditionally hit the donut hole or the coverage gap, when they were responsible for paying 100% of their drug costs. Now they're having discounts phased in to help cover that cost. And in addition, there's a real focus in the Affordable Care Act on prevention and preventative services. And so just under 35 million people with Medicare now have access to free preventative tools, including an annual wellness exam, free mammograms, and so that's been an improved access point for individuals with Medicare. And in addition, just over 70 million individuals who are privately insured and not necessarily enrolled in Medicare also gained access to improved prevention services, so things that would help you stay well before you get sick. And then in addition, we have over 100 million Americans who had lifetime limits removed on their health insurance. So why are we here? So I want to make sure everyone's on the right page. So there's been a lot of talk in the news and a lot of talk, I think in general on the radio, about what the marketplace is. And so you may have heard the term exchange, but the two terms are interchangeable. I refer to the exchange as a marketplace. And the goal of the marketplace is really to provide a place for individuals who are qualified to purchase health insurance at this particular place. And then they're going to be purchasing private health insurance options. So it's not a government-funded program, it's not a government-sponsored health insurance plans. They are private health insurance plans run by some very well-known names and some that would be well-known maybe more to you in the state of Ohio, but less well-known to an individual in Indiana, perhaps. And these plans are going to be known as qualified health plans because they're being offered on the marketplace. And the goal of the marketplace is for individuals to go online and really understand what the cost of these plans are, and what the benefits of those plans are, and make a personalized decision for you and your health insurance. What works best for you, what works best for your family, what works best for your budget. So the goal is really to make those decisions. So 3 things to know about the marketplace. As I mentioned, our goal is to make it really easy to help shop for health insurance. So we're trying to simplify that search. A lot of people have referred to the marketplace sort of like a Travelocity or an Expedia. But the goal is really to make sure that that information, all those options are available in one place. And you're going to be able to make decisions based on cost and factors that are important to you. And in addition, we've worked very hard on having streamlined applications. So an individual, if they're accessing it online or through the phone, it's a smart application. So it learns from the information you plug in, and it will actually make that application shorter by eliminating questions that aren't relevant to you. So they've tried to work on the application process as well. The second key piece to remember about the marketplace is that we're estimating that about 90% of the individuals who are on the marketplace are going to qualify for some level of help to help pay for their health insurance. And we'll talk a little bit more about how that's going to work as I move forward. And then again, that third key point, the goal is to make sure that you have clear and upfront information about the cost of your health insurance, whether that's how much you're paying on a monthly basis for your premium, or what that expected cost might be if you're at the doctor or if you end up in the hospital. And then, in addition, what that information means in terms of benefits. What kind of benefits are you getting for your money? So one of my big take-home points, my first take-home point, which was already mentioned this evening, is enrollment begins October 1st. And by my count, that means we're almost a half a month away. When October 1st starts up, it will kick up open enrollment, and open enrollment for this first year is going to run until March 31st of 2014. So we're giving individuals a lot of time to really make sure that they take the time to go online, talk to someone in person, access that information through the phone, and ask questions and learn more about health insurance options. And if you're an individual and you enroll in the health insurance marketplace plan between October 1st and December 15th, your coverage is going to begin as soon as January 1st, 2014. So that'll be effective January 1st. And then again, we're mentioning that 25 million Americans are going to now have access to health insurance coverage as a result of the marketplace and the application process. So some quick background about the marketplace itself. When the Affordable Care Act was signed into law, the federal government gave states a variety of options on how they wanted to move forward with the marketplace. And so one way that a state could move forward is they could choose to run their own marketplace. And so we do have states across the country who've opted to run what we're calling a state-based marketplace. And in my region, actually, Minnesota is running their own marketplace. And they've received federal grant funding to do that. In addition, some states opted to partner with the federal government. So they are either helping perform plan oversight, so they're looking at the plans and making sure that they are up to date with federal and state regulations and monitoring them. And other states have opted to participate in outreach and education and making sure that their state residents are aware of what the marketplace is. And then Ohio is in the third group, and Ohio has opted to have the federal government run and operate their marketplace for them. So that's why you have the in-person vote. Right now, I'm going to talk about in-person assistance in a little bit. But right now, the federal government is managing your health insurance marketplace, which we're going to discuss in a little bit more in depth. And they're also managing right now the plan oversight in hand with the Department of Insurance, which does have state regulatory authority over health insurance plans. Yes, ma'am.
Does every state have one of these three?
Yes. Every state has a marketplace.
Even those states where the governor decided he did not want to participate?
So that would be the third bucket. So if the state decided that they didn't want to run their own and they wanted nothing to do with the marketplace, the federal government is operating that program. No problem. It gets a little confusing. So again, just reiterating some of those advantages for individuals who are currently uninsured and looking to purchase health insurance. That goal of the health insurance marketplace is enhanced competition, so you have really good plans competing for your business on the basis of benefits and cost. In addition, providing some ways in which we're making health insurance a little bit more affordable, whether that's lowering your monthly premium, or perhaps based on your income you might qualify for, in addition, some support when you're actually at the doctor or at the hospital. We're really focused on high quality health plans, so they're taking things into account like consumer protections, and we're looking really closely at physician networks to make sure that an individual enrolls in Ohio and has a robust amount of physicians that they can go see, clinicians. And in addition, we're paying attention to hospital and clinical quality standards as well. And again, a reiteration that we really don't want people to be surprised, sign up and have a plan on January 1st, and be surprised by costs that they incur in March. We want you to understand what the premiums are going to be, what your benefits are going to be. So that's really that goal of the marketplace. So we have a list of 10 essential health benefits that the qualified health plans have to offer. So this is a way in which those plans are going to be more standardized in the state of Ohio. So they're going to cover benefits in at least these 10 categories. I look at that list and I think they look, if I was thinking essential health benefits, that's about what I would be thinking of. Prescription drugs, hospitalizations, your ambulatory patient services, or when you're going to go to the doctor, maternity and newborn care. A couple highlights that are kind of new to this roster are things like mental health and substance abuse disorder services. That's something that was not often covered under traditional health insurance, and that has been added. In addition, you can see on that right-hand column that focus on preventative and wellness services. So we're really focused on prevention and helping keep people healthy longer. The level of the services have to be at least as robust as your typical employer plan. So it's not just as simple as they offer something, but there actually is a standard that the plans need to meet.
Okay. Also, one of the changes to pediatric services of oral vision,
Yep.
that usually had a separate plan for
Yep.
children.
Absolutely.
No, you don't.
So I just mentioned some of the ways in which the plans are the same. There are ways in which they can vary. So we are talking about health insurance, so there could be some slight variation. So some plans might offer to cover even more services than the 10 sort of essential buckets that I mentioned. In addition, some health insurance plans are going to require that you have a network. So I often recommend, if you really like to see Dr. Monahan, before you enroll in a health plan, you want to make sure that Dr. Monahan participates with that health plan. And probably the hospital in which Dr. Monahan has privileges is also part of that network. Again, you want to make sure you have all that information up front. In addition, those premiums, the co-pays, the amount of money, the co-insurance and co-payment situation you're going to pay for your health services at the point of receiving care. You want to make sure that you have that information. It's going to vary depending on which plan you choose. And the quality of care might vary slightly. Again, as I mentioned, we really want high quality plans in the system. And then in addition, some of the plans might be structured slightly differently, and I'm going to talk about one of them, in fact, right now. So one of the options in the health insurance marketplace that's sort of new is a catastrophic plan. And the catastrophic plan is, the goal is really to help individuals who are under the age of 30 and some individuals who might not be able to afford the health insurance options that are available on the marketplace. It's a way to get those individuals some level of coverage just in case something unfortunate does happen. And so that usually comes with a high deductible, but it still would protect you from even higher out-of-pocket costs if something unfortunate happened. But that would be paired with a lower premium, so that would make that a little bit more affordable, for instance, for young adults who might not have money in their pockets to pay for health insurance. And one of the nice things about that catastrophic coverage is that it also does allow an individual to go see their physician, their primary care doctor 3 times a year, and to have access to some preventative services as well. So there's some nice benefits to that for some young folks and folks who might not be able to afford other options. I'm going to mention quickly about the Small Business Health Options Program, and this is a specific part of the marketplace that's for small businesses and their employees. And so eventually that's going to be for small businesses who have up to 100 full-time equivalent employees. Right now, most states have that limited to 50. And the goal really is to make sure that we know small business employers really would like to offer health insurance to their employees. And we know that that can be challenging for a variety of reasons. It can be more expensive sometimes for small businesses to have access to more competitive insurance rates. And so the goal is really to provide another option for small business employers to provide health insurance to their employees. So a couple things to keep in mind. You're going to access that shop if you're an employer in the state where your business is located. So if you're working in Ohio and your employees are in Ohio, then that's where you're going to access your shop in the market. In addition, you have to make that coverage available to all of your full-time employees. And it's a little bit tricky if you're a sole proprietor, so you own your own business and you're a business of one. Totally understand if you absolutely are a small business owner. But because you're just one, you're going to purchase your health insurance on the individual marketplace.
Before you change that,
Yes.
the biggest stuff in here about a lot of companies changing towards 29 hours a week versus 30, because at that point, they're full time.
Mm-hmm.
You don't have to talk about a number. Tell us how the plan is going to react to that.
Truthfully, to some extent, I probably don't have much to say on that, just because a lot of decisions that employers make are based on their particular business. And so a lot of businesses are evaluating their health insurance options. And sometimes it's in response to the Affordable Care Act, and sometimes it's in response to just their general day-to-day business. And so I probably don't have much to comment on what certain employers are doing or why they're doing what they're doing.
Well, I guess my question is, a lot of companies do it, let's say Walmart does, and they have all these employees that don't have coverage. Is there someone they can go to get coverage?
Yes, so exactly the health insurance marketplace that we're discussing today.
That is, so they're the ones that should cover you. I'm trying to find out why they're doing so much against it. Is it because they have to pay the money that the employees will have to pay individually? You see what I mean?
Sure. I think that the key is that businesses in general have a lot of reasons why they do and don't offer certain benefits, and healthcare costs can be expensive. And so what an individual business is probably evaluating might be the bottom line. It could be what their benefit, how much money they just have available for their benefits. And so I can't probably comment on the business decisions behind that. But what I do know is that if you work for an employer who isn't offering you health insurance, then what you do have as an option now is the health insurance marketplace. And we'll talk about ways in which that could be more affordable for an individual who may not have access to employer coverage.
So is this saying an employer does not have to offer insurance? Or is it saying that small businesses do have to offer
insurance?
This is a way, Barry might be able to clarify something. There are certain thresholds of number of employees where actually they don't have to offer health insurance because they're of a certain size on that smaller scale end. But the goal is really for small businesses. And as I mentioned, I actually talked to a lot of small business owners. It's not a, I don't want to offer health insurance. It's actually that if I have 10 employees, I might not be able to access as a competitive rate as my employer can because I'm a federal employee and there's thousands of us. And so the goal of that shop is to sort of build a risk pool of those small employers to help give them access to some competitive rates. So, and then the next slide. In addition, there's a small business tax credit that's also available to small businesses that they can have a tax credit for towards the cost of putting money towards their employees' health insurance. Barry, you want to, I could say? Barry's with us from the Small Business Administration.
You hit it just right.
Okay.
Less than 50 employees are exempt from employer responsibilities. Over 50 employees, and there's some triggers, whether it's affordable minimum or if they offer health care. 96% of the businesses are exempt.
Yeah.
Plus they have less than 50 employees. 96%. And you have very few that have more than 50 employees that are not already offering some sort of health care. So,
Most people generally will continue to get health insurance coverage in the manner that they're getting health insurance coverage through their employer, their spouse's employer, Medicare, through the VA. So there's a variety of ways in which people have health insurance coverage. The marketplace is one more way for individuals who don't currently have that health insurance to get that. So one more time, that initial enrollment period is creeping up on it. It's October 1st. And as I mentioned, this first enrollment period is going to run until March 31st. We know this is going to be, for some people, their first toe into the world of health insurance. Maybe they haven't had it before, couldn't afford it before. So we want to really make sure that anyone who's looking for health insurance has adequate time to go online, to talk to an individual, to call on the phone, and talk about their health insurance options. Every year after this first enrollment period, the enrollment window will be October 15th to December 7th. But this year, you have until March 31st of 2014. And in order to, yes, is your question?
Go ahead.
Okay. In order to be eligible to purchase health insurance in the health insurance marketplace, you need to live in the service area. So if you live in Ohio, you're going to be working with Ohio's health insurance marketplace. You need to be a U.S. citizen or national, or you can be a non-citizen who's lawfully present in the U.S. And we do have a list of ways in which you can be here as a non-citizen lawfully present on our website. But you need to be here for the whole time in which you're seeking coverage. So if you're here as a non-citizen and you're looking for health insurance coverage in 2014, you need to be here for the entire calendar year of 2014. In addition, you can't be incarcerated unless you're pending disposition of those charges, but you can apply for Medicaid or the Children's Health Insurance Program at any point during your incarceration. No enrollment period for that. I'm kind of a pictures person. I sort of like this slide because it gives you a little bit more than writing on the slide. The idea really is that there's a lot of things sort of happening at the same time. But over to the left, that button says that you're going to submit a streamlined application to the marketplace. And there's a variety of ways in which you can actually interface with the Ohio Health Insurance Marketplace. So that can be online, with yourself and a computer, with a family member. You can talk to someone over the phone, and I'll give you that contact information in a little bit. You can sit down with someone in person in the state of Ohio and talk to them about your plans. And in addition, we do have a paper application, because we do understand that not everyone's going to be comfortable with the idea of looking at health insurance options and enrolling on the phone or online. So there is a paper application. One of the cool things about not doing it via paper is that if you're working on the phone or online, there's this eligibility, this data services hub. And the data services hub in real time as you're going through the application process is a whole bunch of information sort of talking out in the cloud in the universe on the internet. So it's verifying information from Social Security, it's verifying information from the IRS, it's verifying information from my agency to make sure you're not Medicare eligible, and it's really working through all of that information to determine those next steps. Is purchasing a qualified health plan the best option for you based on the information you submitted? Or perhaps based on the income that you submitted, you might qualify for Medicaid. Or maybe you have children in your household who might qualify for the Children's Health Insurance Program. So all that's happening in real time if you're doing that online or through the phone to streamline that. Versus if you submit a paper application, that will happen. It's just going to take some time for an individual to review it and send it on. And then you would take the steps to either enroll in a plan or enroll in Medicaid and CHIP. So again, just to reiterate that there are a variety of ways in which you can interface with what I'm talking about the marketplace. So online, through a phone, talking with someone in person, or again, by mail and a paper application. Lots of options. So that toll-free call center that I mentioned, it's 1-800-318-2596. And I'll repeat it. 1-800-318-2596. We have customer service representatives that are available 24 hours a day, 7 days a week, minus a handful of holidays like Thanksgiving, New Year's Day, Christmas Day. They can assist callers in English and Spanish, and in addition, 150 additional languages, depending on what an individual's language needs are. And right now, until the end of September, they're taking general questions. Questions from anyone in the state of Ohio, because the federal government is operating their marketplace. This is your toll-free call number, so you can call that from the state of Ohio. And they'll also answer questions for employees of employers who are working through that Small Business Health Options program, that SHOP. In addition, we actually do a separate call center that's available for the SHOP employers if they have questions. And then starting in October, this 1-800 number is going to be where an individual can call and talk to a trained customer service representative and actually enroll in a health insurance marketplace plan. This is my second big take-home point. Healthcare.gov is your online Ohio health insurance marketplace. So my take-home point number 1 is October 1st. It's a really important date. And my take-home point number 2 is healthcare.gov. If you're an online person, this is your one-stop shop. So right now, I'm actually kind of excited about the website. We've been getting some really, really great feedback on the website. It does not look, in my opinion, governmental. It really is consumer friendly. In my past life, I actually worked for an entity that audited the federal government. I audited some of their websites. I'm really delighted with this website. They really worked long and hard. It's responsive. You can provide feedback on the website. We encourage you to do that. You can find links to a variety of other partner pages, one of which I'm going to show you in a second. But right now, the focus is really frequently asked questions, learn a little bit more about the marketplace. You can sign up right now for an account, and we will email you updates and alerts. So it's a really great way to get in touch with health insurance before October 1st. And then on October 1st, that site is going to go live where you can actually get health insurance. You're going to be able to go online and look at those health insurance plans and review those costs and benefits. So that's going to be a second take-home point. So that other piece of it, so we've discussed the phone, and I've now talked about your online portal to the marketplace. There's other ways in which you can get help, and one of which is there are a variety of ways in which you can talk to someone in person. So one entity that we have available is the Navigator programs. They're grant recipients. They have a federal contractual relationship with the federal government, and they are going to be in the state of Ohio. We awarded 5 Navigator grants in the state of Ohio. The Ohio Association of Food Banks is by far your largest Navigator grant, and they are operating statewide. And And so they are going to be a great way, as well as the other 4 entities, Claremont Recovery Center. I have a list in my bag, I'm blank. There are 4 other entities as well, but the Ohio Association of Food Banks by far and away is your largest navigator. And they're going to be trained. They are going to go through an intensive training program with my agency to make sure that they are well equipped to help individuals understand the health insurance options and help them understand what they're looking at based on costs, and then that individual will make the best choice for them and their family. So they're going to help you navigate those waters, but you still as an individual will be responsible for making a healthcare decision that works best for you. In addition, we also will have other trained enrollment assisters. So we have programs that also individuals will go through training. They will also be able to help any consumer understand the health insurance options. And they can be found in a variety of locations, including federally qualified health centers, local community health centers, community organizations. And then that third important piece of in-person assistance is the Asian broker community. They have played a really important role in providing access to health insurance for individuals for decades and decades, and they will continue to provide an important role in helping people understand the health insurance options that are available to them. So I mentioned at the beginning of the presentation that there's a way in which some of the costs associated with the health insurance marketplace could be made a little bit more affordable. And so one of the ways is this refundable tax, the advanced premium tax credit. So that can be applied at the point of enrollment to lower your monthly premium. So that's going to lower that cost that you're paying every single month for your health insurance premium. And the eligibility for that particular tax credit is based on your household income and your family size. So this gives you a little bit of a guideline. That's going to be 100 to 400% of the federal poverty level. So just under $24,000 and just over $94,000 for a family of 4 was the marker for 2013 program. So in addition, if you qualify based on your household income and your size, then you can purchase qualified health insurance through the marketplace. So you need to be purchasing that product through the marketplace, whether that's in person with an agent broker, through the website. You can't purchase Montana Health Plan Choice directly with Montana Health Plan and have access to the advanced premium tax credit. That happens through the marketplace itself. And the last piece of information that's important to know is in order to qualify for the assistance or some extra help, you cannot qualify, you have to be ineligible for other types of health insurance. So that would be your employer plan, that would be you're enrolled in Medicare, you're enrolled in the VA coverage, you perhaps are enrolled in Medicaid. So there's a variety of ways in which you would not be eligible because you actually have access to affordable coverage health insurance. In addition, there's a premium tax credit. If you don't want to apply them directly to your monthly premium, you can claim it at the end of the tax year. So another thing that people are aware of is starting in 2014, most people do have to have health insurance coverage. And so as I mentioned a couple slides back, we talked about the fact that most people do have some form of health coverage in this country, whether that's their employer, their spouse's employer, those government forms of insurance, Medicare, Medicaid, CHIP, the VA, and then now with the health insurance marketplace. So if you don't find yourself covered in 2014 from that variety of health insurance options, it's possible that you might pay with your tax return. It's going to happen when you file your 2014 tax returns in 2015. And there are ways in which you might qualify for an exemption from that fee. This is my third take-home piece, because I think there's confusion, and I want to make sure that I'm getting into the community and helping everyone talk to their moms, their grandmoms, their neighbors. If you have Medicare, you don't have to do anything with regards to the health insurance marketplace. The health insurance marketplace is not a part of Medicare. Your Medicare benefits are not being impacted by the health insurance marketplace. So I encourage you to review your prescription drug claims, but you don't have to do anything with regards to the health insurance marketplace. You have really good coverage. You have affordable health care coverage with robust benefits, And in addition, you wouldn't qualify for those advanced premium tax credits towards your monthly premium because you have access to Medicare. So I just want to make sure to reiterate, Medicare, you can stay exactly where you are. You don't have to do anything with regards to the marketplace. Just a quick note, there was such a plan called the Pre-Existing Condition Insurance Plan. And this is a plan that was intended to build a bridge for individuals who previously were either priced out of the health insurance market because they had a pre-existing condition and it was too expensive for them to purchase health insurance coverage for that condition. Or perhaps they had health insurance coverage but it actually carved out any benefit around that condition. And so that program actually is ending this year because starting January 1st, insurance companies can't discriminate based on your pre-existing condition. So Medical Mutual of Ohio ran Ohio's program, and they are now transitioned with the federal pool of the rest of the country. And then we are alerting individuals who are enrolled in that plan so they can go on the marketplace. Because again, we don't want to auto-enroll anyone. If you really want this health insurance decision to be about you and what you're comfortable with and your costs and making the best decision for you. But we are letting those individuals know so they can sign up for seamless coverage. So as we move forward, we're gearing up August and September. We're training those navigators that I talked about. And we're training the certified application counselors. And we're also training agents and brokers. Our agent and broker training went live. Our shop call center went live. And then October 1st, you're going to be able to go on healthcare.gov or call the phone number or talk to someone in person, and you're going to be able to actually look at your health insurance options and possibly enroll for December 15th. To have active coverage as early as January 1st. Then a couple other things, as I mentioned, that discrimination against individuals with pre-existing conditions also happens in January. The advanced premium tax credit for your monthly premium is available. That small business tax credit we chatted about is available. And then I have another website. So if healthcare.gov was not enough for you, you need to know more. Because I know there's one or two in every presentation I give that they're really excited. This is our website for partners. It's marketplace.cms.gov. And what I actually do like about this website is you can actually download my PowerPoint presentation. And you can also download my PowerPoint presentation with all of my speaker's notes. You can share that with members of your community. We also have live videos. You can actually sign up and take a training with a staff member in Baltimore. You can also watch a YouTube video where someone will do this presentation for you. So if you have someone that you really want to share this information with, you can do that on demand. And that's a way in which you can also download our widgets and badges. Anything you want to do is spread the word via social media. We're really excited about partnering with people about social media. So I really like that website if you're really excited about working with us further. And so a couple key points to remember, that this marketplace is a new way for individuals who don't have health insurance to have access to affordable coverage and to make those decisions, yes.
Define the word marketplace.
It's a little wiggly. The marketplace is an idea about where an individual can go to get health insurance. When I think of the marketplace, I think of it being an online portal, I'm going to be honest with you. I think about it in terms of a website where you're going to be able to look on one page and scroll and see all of the health insurance options, and you can compare them. That said, calling the 1-800 number call center and filling out a paper application still gets you access to the health insurance marketplace.
If I was to replace the word marketplace with Aetna, Blue Cross, Blue Shield, and litany of insurance company, is that marketplace?
Not quite. I think about it like, let me think about it. This sometimes people like this and sometimes people don't. So I'm really sorry if this is not the way you like to think about it. I think of the marketplace as being like an Orbitz or an Expedia, where you would go online and looking, I need to go from Chicago to Columbus. That's my goal. So your goal is I want health insurance. And if I was on Orbitz, I could see, gosh, American is gonna charge me $300, United's gonna charge me $250, and all of that information would be in one place where you're looking, and you would be able to tell if you're searching for flights. Gosh, American is cheaper, but at the same time, American wants to fly me from, O'Hare to Dulles to Tallahassee before they're gonna get, so you would know in one spot, if you're picking a flight, that based on what you're comfortable paying and how you wanna get there, that's what you're gonna choose. And that's sort of how I think about the health insurance marketplace. One place you can go where Humana, Blue Cross Blue Shield, Aetna, anyone you can think of, is gonna be all in one place where you can see, I'm comfortable paying somewhere between, I'm picking numbers, because I don't know what the prices are gonna be, but I'm comfortable paying about $100 to $200 a month for my health insurance. Well, what are my options? And then once I see what those options are, I can then see what types of benefits are they offering. What's the difference in, maybe I'm paying a little bit more here, but I'm not paying as much when I see my doctor. And so that's an individual decision. Some people want to pay a little bit less on a monthly basis because they don't think they're going to see the doctor. Some people know they're going to see the doctor. They'd rather pay more on a monthly basis and have better coverage there.
So, okay, so if I got it.
Okay.
I'm sorry, I have a PhD on public high school.
No, it's confusing. It really is.
So, we're shopping insurance companies.
Yeah.
And I'm comparing one person's insurance against another. This is not a federally funded program. It is the existing insurance company.
Correct.
Now, is it, can it go from state to state if I find something in Alaska?
So if you are someone who, that's a good question. So you're someone, let's say, who lives in Ohio, but you cannot handle the winters. They're right there myself in Chicago. And you need to go to Florida for the winter time. Then that's one of the, remember we talked about networks and making sure the Dr. Monahan is in my network. You're probably gonna wanna go in the health insurance marketplace and you're gonna be looking for a product that not only covers you in the state of Ohio, but might cover you out of network if you wanted to be in Florida for part of the year. And that's an important factor for me as a snowbird. I can't handle it. I have to go to Florida for the winter time. But those are the types of information that when you're in the marketplace, whether that's talking to my friend Brenda next to me, and we're doing this together, or you're talking to Brenda on the phone, those are the types of things that they're going to talk to you about. Talk to you about what types of physician networks do you need. And all of that's going to be upfront before you sign up. So you'll know ahead of time. So the goal is to kind of put that all together and make it hopefully a little bit easier so you're not on Michaela's website and you're writing down a whole bunch of information. And then I've got to go over to Brenda's website and you're writing down a whole bunch of information. It's just trying to pull all of that together so it's a little bit easier to understand. Does that make sense? Yes.
If you can indulge me just for a second. So let's just say it was Blue Cross Blue Shield plan that I was under, and I think it was the way it used to be. And all of a sudden, they're also the same insurance company is in the marketplace. Okay. Theoretically, you can look at the marketplace and find a better pricing status than your current one at the company that you are at. Is that possible?
I suspect that's not going to be possible. The reason why I suspect that's not going to be possible is that you already have access through your employer. So what's going to happen is that you already have access to a plan that your employer is contributing towards that cost.
Right.
You're not incurring that full cost of the monthly or the annual cost. If you're on the marketplace, you would be paying 100% of the cost minus, for instance, whatever level of support you were getting. If you're in the marketplace and you had employer coverage, you're not going to get any help. So what you're going to see in the marketplace is a full cost of health insurance without any subsidies or support, whether that's from an employer or whether that's through the advanced premium tax credit. It is theoretically possible, but I can't comment because I don't know what the plans look like. But I think that's going to be not likely, if that makes sense.
So then, I don't see why everybody get upset about it. If you already are under a good health plan,
Yeah.
then all of this means nothing to you.
Correct.
They didn't come to this meeting.
Yeah, so the goal here, so one way to simply look at this really is, and that's sort of why I try to make that message clear. This is really a way for individuals who don't have health insurance to get access to health insurance.
Okay, so here's my.
Absolutely.
Why did they set this thing up in the first place to just talk about that? Instead of, in other words, all I heard was the negative stuff about this.
That's why I'm here.
I know you came about a year, 2 years too late. I mean,
No.
well, the point I'm trying to make is that you're trying to sell a product out in sales.
Yep.
You put your best foot forward and say, hey, this is what this thing is about. This is really about the people who don't have insurance. Not, you already have a good plan. You don't even, this is not even an issue for you.
I think that's the point you're trying, and that's why, because there is a lot of confusion out here, so Reggie, that's a good.
Yep.
We got hands up back here.
Oh, sorry.
Hand up first.
I just
And I think we'll, your answer here.
Scenario to maybe help out to help clarify, because I'm an insurance agent, so.
Oh,
And so healthcare is insurance, that's all it's about. So going back to about shopping around the marketplace would be your independent insurance agent, for example, where you go for auto and home, where an independent agent can go and actually price out, compare like 5 to 10 different companies. Or if you went to a captive carrier, like a name brand carrier, you would have to buy their box package. So the marketplace is kind of like that from an insurance perspective. But the marketplace, you look at it as a big gigantic blueprint, because as we all know, we trying to sell individual healthcare insurance, it's expensive only because it's not tied to a group plan. Your employer helps pay for your healthcare costs because they group all 500,000 employees or so out, and they can say, okay, this company, Aetna, whoever, is going to give you a group rate. They not, irregardless of any pre-existing health conditions. But if you're an individual trying to get health care, you cannot, especially if you have a pre-existing condition, you cannot get health care, nor will you pay the favorable cost. You can pay about double the amount. And a perfect example of that would be COBRA insurance. If you were employed and you got laid off, the law states that your current employer cannot charge you no more than 100%, 101% of your current health care. So that's to kind of help show to you how much your employer is really helping you pay for your health care based on the fact that you're in a group plan. So the marketplace is just a great.
Here's something that might help a little bit with this, okay? Yeah, we'll get in there. But I pulled this information down actually from, I think it was healthcare.gov.
Yes.
It's a great site. If you've not been on it, it really is very easy to navigate, very easy to understand what they have. But here we go. So we have 1,354,869 Ohioans who are uninsured. It's 14%. So that kind of large number, you can see why then it's like this mass education, and now we've got to really hone in. So it was very confusing. Some of it, you know, I'm making a political statement, which I'm not going to do, but I would say, you know, it was the name of the game before. But with that, that's a large percentage, and 36% of those people are 18 to 35, and on and on. So here's what got me: 55% of males, 749,429 in Ohio, males. So Will's not. Will. He's
I'm ready.
Under the Affordable Care Act, is the marketplace controlled by the state?
No. So, well, okay, so back to that original, the slide very, very far at the beginning. Some of the states, I'm going to pick on Minnesota because they're one in my 6-state region. They're actually controlling their own marketplace. They receive some federal grant dollars. Thank you, ladies, for coming. They receive some federal grant dollars to operate their own marketplace. So they actually are in charge of their own. They have their own website. They have their own call centers. They are responsible for choosing their own plans that are operating in the marketplace. That was a state decision. In Ohio, the federal government is running that program right now. So Ohio's not alone. There were more than a handful of states who opted to have the federal government run it. and/or they're moving their way towards running their own, they just weren't quite ready yet. Yes?
Okay, well, how long do you think it would take for a person to complete an application? I understand the smart, taking things out,
Yes.
basically, but just generally, how long?
We did some focus groups, and the last estimate that I heard was that for a simple, straightforward application, probably for an individual or straightforward family, they were running 15 to 25 minutes. And then it could get a little bit longer if you are an individual with a little trickier family situation. Yes?
Well, and the affordable health plan, will that affect premiums in the future for, across the board with health insurance?
I'm not sure I have a good answer for you on that. There have been a lot of studies done. I'm sure you're aware of them, and a lot of them keep cropping up. I think that we're not, I think they're not entirely certain what the impact of the marketplace might be on health insurance plans, any more than honestly any change from year to year. The economy, a lot of things change health insurance costs. So I'm not sure that I can say, as a result of the ACA, this will happen.
What was this question? I couldn't quite-
Oh, the question was whether the ACA will have a direct impact on health insurance premiums, raising them, lowering them, moving forward.
Well, one thing for sure, starting January 1st, insurance companies, whether they're in the marketplace or not, cannot increase their premiums by more than 10% without approval of the government. And they must now start paying 8% of your premiums towards your health care or to improve the quality of health. That already started. So thousands of checks went out in the state of Ohio in June on these rebates. Because now insurance companies can only use 20% of your premiums for administrative costs. So they have to get those bonuses for their CEOs somewhere else.
Yeah, the secretary does have authority to review insurance increases across the country. And she did exercise that authority in a variety of states in the last year.
So that's big. I mean, that affects the premiums.
Oh, yeah.
It affects when you start thinking about premiums that have been increasing anywhere from 30 to 60% annually. That now is going to be a cap. So there might be an initial rise, this year. But overall, it should over time, just kind of balance out. Of course, that depends on healthcare costs and other things. But the more people that are insured, the less pool of money that doctors and hospitals as a whole are uninsured, which means that they don't have to pass those dollar amounts over to insured people. So it eventually will even out. It might be rough initially, but
That refund, the average refund is $133 per family.
you probably won't see those
You probably
refunds
won't.
after this year.
Well, that's what, I think you're right,
Yeah,
but
they
they
make it
really, I think the point is it's being very thorough about making sure that the coverage, that we maximize the coverage so that this business, the CEOs and so forth, with the insurance companies getting the better part of your dollar goes away. So that's what that's intended to do. I might mention that these two gentlemen here, in case there are questions, are with CareSource. And CareSource, like some of the other managed Medicaid programs out there, they'll be doing, also doing this kind of information sessions in the community. And they could actually go on your website as well and find out where those sessions are going to be. Is that right?
Yes.
And CareSource is actually, from my point of view, the first one out of the box in terms of managed Medicaid programs going around and doing this. The navigators, there should be some information coming shortly where they're going to be. Our health center happens to be part of that large Ohio Food Bank Association grant, and so we're hiring a navigator. That's what we got wanted to have. And then we also have these certified application counselors. All these people have to go through training. That's the big thing there. And then we'll be out also doing community education. I know that the Ohio State University, their Western Westland Medical Center. They're going to be doing outreach and engagement. Mount Carmel Health is. My understanding is that at this juncture, Ohio Health is sitting this year out, so they are not going to be participating. Okay, so, but there's going to be a lot of these kind of sessions going on, but I think Michaela has the best idea. I've been on the CMS website as well. Information is really good on there, so. A couple more questions.
Yes, I haven't heard anything about people who are not employed. Are they mandatory for them to get insurance?
It depends. There are some individuals who might qualify for an exemption from that fee for having to have health insurance. And that could be, it could be that an individual who's unemployed, who doesn't have access, and any of the other ways in which we talked about it, based on their income, they can possibly apply for an exemption, a hardship exemption, because they just don't make enough money to afford to purchase health insurance coverage.
My daughter, for example, has a full-time job. She is in Charlotte, North Carolina. Her company does not, their plan is so bad that I think it covers 3 aspirins and a Band-Aid for a year. She, I keep telling her she doesn't have any insurance. But under the law, she does have insurance and they provide it. It just doesn't cover anything. And there are so many people who are now falling in that category who are the working poor, who have a job, they're only making $9, $10 an hour, and they can't afford to pay for health insurance. And there's so many employers who are now cutting their hours so that they don't have to provide it. That's becoming an increasingly large market in America. How is this plan going to address that if it was never meant to?
Well, employers in general have to meet a certain standard in their employer plans for their employees to not have to access the marketplace. So that's that minimum essential coverage that I mentioned. So things like Medicare, Medicaid, VA. There is that essential health benefits chart that I mentioned. There actually is a standard with which employer plans need to meet in order to be considered minimum essential coverage. Overwhelmingly, most employer plans do meet that threshold. Employers are going to start letting their employees know that they are in a plan that meets that minimum essential coverage. So I don't know, without getting into the specifics of your daughter's healthcare coverage, it could be that her coverage is so bare bones that it doesn't meet that threshold. She would be able to access the health insurance marketplace.
But North Carolina is one of those right-to-work states, so.
Well, but if they're, I don't know what that state is doing for their marketplace. I don't know if they have state-based, but if they don't, healthcare.gov is where she would go as well for her health insurance. Yes?
I didn't quite understand his question, but I got a question. I met a lady today, and she's working for minimum wages, and she's working part-time. Now, how can she find out how she's going to be eligible for this affordable care? And she got a mentally retarded child.
So what she's going to do as well is go through healthcare.gov, whether that's through the website or through a phone.
Suppose you don't have a website.
You can make that phone call to the 1-800 number that I mentioned. So if you don't like the website, that number is 1-800-318-2596, and you can talk to a customer service representative. And so that's another avenue that's available to you. In addition, as we mentioned, there's going to be individuals around in the community available who you can sit down with Michaela. And Michaela's going to take your income information. I'm going to help you with that application. And I'm going to help you understand what the various programs are that you might qualify for.
Also, I don't think you mentioned that is there still a penalty if you do not enroll?
Yeah, so our goal is really to make sure that everybody has access to that coverage.
To kind of explore a little bit more on your question, Employers are not required to offer part-time employees health care. However, under the individual mandate, she will have to be covered under some program. Hence, then she goes to the marketplace, and because of her income, then there will be subsidies and cost shares that will bring it to a level of the money that she's making to be able to afford health care. If she cannot still afford health care within the marketplace because it exceeds 9.5% of her total family income, then she will be exempt from any penalty.
It's 8% of it, it's confusing, it's 8% for the hardship waiver, 9.5 for the employer.
80% of her annual income. So for that example, for part-time employees, whether at Walmart or wherever they are, if they're reducing their hours and become part-time employees, they're not being offered health care insurance, they will qualify over in the marketplace. Now for those employees that are trying to reduce down to less than 50 employees, I do presentations to all over the state. That's not happening. They've talked about it, that's not really happening that much. Those are only companies that are really, really close between 51 and 49, but even with that, that's a business decision. If you want to reduce your staff, to part-time employees, that's a business decision that you have to make, but that's not happening as much as people are hearing.
Yes.
In the past, I know insurance companies and hospitals and doctors negotiate for contractual information. Now, will that go away because of this new?
No, the insurance industry is going to remain the insurance industry to some extent. And so, and just these products actually have networks. I mean, each plan itself is working in a contractual relationship with providers and with hospitals. And so we are not enforcing, they must be working with so-and-so. I mean, this is it. We are actually facilitating a place for people to purchase health insurance, and it's private health insurance. And so what the Blues decision they're going to make about their business and their networks is a Blues business decision, and the same is true for Humana and Montague Choice RX and all the way down the line. So we're not imposing changes for the insurance company, other than some of the ones you mentioned, like for instance, like the 80-20 rule and some of the, like, that was the administrative amount of money they can spend administratively towards your benefits, things like that. But no, I mean, we're not trying to change the way the world is doing business right now. We're just trying to make sure that people have options and ways to access health insurance in an affordable way, give people coverage.
So,
Yes.
when I see all this in print, it says you may pay a fee. It's not like you will pay a fee. And so, it's my understanding the first year, the fee or the penalty may be $95. Okay, so if it's $95 and I'm just thinking as a consumer, I mean, that's really no big deal. It's not a lot of money. But then, my understanding is on the second year, it goes up. So it wasn't quite big, but I'm like, I just don't see the incentive or the motivation year one for people to jump in, because the fee penalty is not really that much, and you may pay it, you may not.
Right, the reason why they say you may pay it is legitimately because there are going to be individuals who are going to qualify for an exemption based on their income. There are individuals also who qualify for an exemption based on, for instance, some religious reason. And there are categories of people who will qualify for an exemption. So we don't want to go out and say everyone's going to pay a fee, because that's just not a factually true statement. I can't necessarily say what will or won't provide an incentive for someone, whether the $95 is going to do it. What I do think is important is just, I think health insurance is important for people, and I think it probably is an important decision for most people. And so I think the goal that I have is really to make sure that people know that there is health insurance available. You have access to it. Here's the information I can give you to talk about why it might be more affordable for you, that perhaps maybe we can actually get you health insurance that the cost looks so good that you're kind of like, maybe it's better to have that than not have it. And so the goal is really, I want to make sure people, education-wise, know that this exists and know that they can get help on their health insurance costs and know that there's a place for them. I can't decide what is going to necessarily to the skills.
You were asking what incentive that would be. That's $95 per person in your household that's not insured. So the first year that they not seen that much of your refund, if you get a $2,000 refund, you know, we don't lose $300. Next year, it's $300 some odd times each. And the next year, it's $600 some odd times. And then it continues to increase with inflation. So the incentive will be there. After people start losing some of their refund, it's going to get to a point where it's not advantageous to not have health care insurance just because you don't want to have it.
We have any other, I just want to say, it's going to be here.
Oh, yeah,
I just want to say, Michaela, I think you did a great job.
thank you.
Because I've been in, I can't tell you how many meetings, and it ends up like mud at the end, oftentimes. So this was really good, and I would encourage each of you to remember the 3 takeaways. Number 1, October 1 is coming. So all the stuff that you read or hear about Congress trying to repeal it, they've already tried like about 40 times every month. Seriously, it's not worked, just roll it. That's where, and the rest of us are just rolling. So October 1, that starts the enrollment period. It goes until March 31st of 2014. But January 1, 2014 is actually could be in your new health insurance plan. Secondly, make sure you go to healthcare.gov. We cannot stress that enough. It's a real simple thing to get on their email list and the updates are great. They even give you a little countdown, 22 more days to go or whatever it is now. And the third thing, it's 2 way. And the third thing is that Medicare, if you're on Medicare, you receive Medicare,
Family members.
don't worry about this stuff. Don't even concern yourself at all with it. Yeah, family members and all that, because this does not apply to you or to them. We really need for you, though, to spread the word and get people on that healthcare.gov. And then just be aware of when there's additional sessions. I think if you can make a commitment, get the list, get the calendar. These guys, like I said, from CareSource, they already have their calendar set. We're getting ours set.
I think I'm going to spend a lot of time in Ohio the next couple of
Yeah,
months. We'd
yeah.
like you to come out and talk to some community groups.
Exactly. And there's no competition with this.
No.
So because you go to one that CareSource might be giving, or you come somewhere else, you need to just get there, get the information, and take somebody with you.
And to get our schedule, caresource.com, and that will give you all of our educational presentations. Places, location, products.
And the Small Business Administration is also doing a presentation.
So there's a ton of them. All of the information should be consistent across the board. So get somebody by the hand or with them. It's great. Once you leave, I would guarantee just about, I think I can guarantee when you leave, you'll have that moment where it's like, what was that? I loved it. I can download her presentation and her notes. Okay? I stopped writing.
What do you need from me?
That's really good. So again, we want to thank all of you for coming. Help us to spread the word. Really important, and it's a great thing. When you think about it, no pre-existing conditions. Everybody will be covered. And here's the truth. Even with our federally qualified health centers, bottom line is it's a business. And so there's only so many uninsured self-pay patients that federally qualified health centers can take. We have 1 free clinic in Columbus, 1. And all of us have a contract with them for referrals to our sites, but there's only so many. So we're real hopeful that our self-pay patients will get signed up on one of the plans, and we're going to be very aggressive about what we call in-reach, as well as reaching out into the community. Okay? So I would think, Michaela, again, thank you for coming. I'm sure she'll be around in at least 5 minutes or so.
Yep.
See these gentlemen, see Barry, if you have some additional questions. Thank you so much for coming.
And thank you.